So I did, which ones did I do here? I did, for the first scenario, I did 1D, which was the clavicle pain. So first off, I would check for scene safety. For PPE for this one, I don't really think I need any, but you could use gloves or maybe a mask because it's 2020. I would want to use the triangle sling to treat, along with the pin and a little bit of gauze. So initially, I would um, have the long end of the sling go across the body towards the hurt shoulder elbow. I would hook up the sling and then I would pin it by the elbow. And after I had the sling on, I would wrap gauze around my patient just in order to keep his arm close to the body. And after I had my sling all done up, I would make sure I'd want to assess for like circulation, motor, and sensory. So make sure my patient can like still move his fingers, still has feeling in his fingers. I have a pulse down by his wrist. Um, you don't really need any. I would definitely tell the patient to go get an X-ray of the area or go to the hospital or emergency room. But for the bare minimum, you can definitely give them a sling. And then I did scenario 2D, which was the patient with the burnt back. Um, for that one, I would check for scene safety, make sure I'm not going to burn myself or anything like that. For PPE, I would definitely want to use gloves just because the patient is blistering and you would want to be wary of that. I would also probably use a mask um, just because it's 2020 and you have to wear a mask everywhere now. Um, I would definitely apply a cold compress to the area. I'd give the patient some ibuprofen, some water, and I would apply aloe vera and antibacterial cream just so the area kind of stays as sanitary as possible. Um, After that, I would just try to ice the area or chill the area. Just make sure, but be wary that the patient isn't getting too cold or could have the opposite effects from ice, like hypothermia, and then I would call 911 because that is an emergency situation and it's a pretty big burn, all in all. So I guess what would I use to treat for that? I used ibuprofen, water, aloe vera gel, and antibacterial ointment, and just a cold compress, so a towel, I guess. I don't think. I think that's about it. Thanks.